Doing good, Edamar, doing good.
So right now we're standing in front of the USF Children's Hospital. Most people think that when they come to the hospital, they come to get better, and then they leave not expecting where the products that are used to help them get better go. Little do most people know the amount of waste that's produced by most hospitals.
No organization currently tracks how much medical waste is produced in the environment, but the last current estimates were from the 1990s, and it says that there are 200 million tons produced each year.
What is medical waste? When most people think medical waste, they think big biohazard stickers and anything else that might be considered poisonous. But medical waste is actually defined as any solid waste that is generated in the diagnosis, treatment, or immunization of humans or animals.
Hospital wastes are categorized according to their weight, density, and consistency. There are 4 different categories of waste. Number 1.
Infectious.
Infectious describes waste that has the possibility of causing infections to humans. It can include human or animal tissue. Some of these things include blood-soaked bandages, discarded surgical gloves, shocks, or random swabs they use, like something in your mouth or something that they discard. Number 2.
Hazardous.
This can include sharp materials, usually like syringes or knives they use during surgery to cut you open, something that would be soaked with blood, or culture dishes. Hazardous waste can also include chemicals, and these are both medical and industrial. Number 3.
Radioactive.
These describe waste that result from nuclear medicine treatments, such as cancer therapies or medical equipment that uses radioactive isotopes. Number 4.
The catch-all. Other.
General waste makes up at least 85% of all waste generated at medical facilities, and is no different from general household or office waste. This includes paper, plastic, liquids, any other material that doesn't fit into the 3 categories. So it could be anything from, front desk equipment to something that they're using just in the room.
So we're right now standing in front of the USF Student Hospital. There's one of the employees, her name's Christine. I'm just going to answer a couple questions about kind of medical waste. So, about how much on average do you think medical waste is produced here, roughly, per day?
What, in like pounds and tonnage?
Or well, just in terms of with what you work with. Like, how much medical waste do you usually deal with?
Depends on, medical waste as far as...
And everything go from, wasting plastic gloves or,
A lot.
A lot? You guys run through a lot of it? So do you think the hospital spends a lot of money on trying to take care of those things? On trying to dispose of them properly?
I would imagine so, yeah.
Do you think the waste that comes out of here, how much of it do you think actually goes back into the environment, or do you guys have any ways of recycling or reusing any of the waste that you guys produce here?
Not that I know of. I don't work in biomedical. You might want to hit up on the 4th floor.
We try. We're going to database.
Okay, well, I know that we have separate bins for things, so I think that the hospital tries everything that they can.
So you think the things are disposed properly?
Yeah.
All right, because we're just looking out because we realize that, the main goal or the objectives of these hospitals is to take care of the kids. But if it turns out that the medical waste that gets produced here ends up in some way going back to the environment and harming kids, we're just trying to figure out what the hospitals are doing to try to minimize, that from happening.
I think that they're...
Alright, so right now, I'm standing with Aaron and Fachi, both employees that work at the hospital here. Would you guys mind telling us real quickly what it is that you guys do here, or how you do it?
I'm a resident.
Medical student.
So, in terms of contact with patients, how often do you guys, work with patients directly, and how often do you find yourself disposing things? How many pairs of, for example, latex gloves do you think you always go through in a day?
So, I see all of them would require hands-on examination, and I would usually wear gloves, at least one pair of gloves for each exam. Those are disposed of for biohazard waste, because that's all that's up there. And occasionally we will do procedures, suturing, suture removal, line placement, etc. All of that stuff is also disposed of in biohazard.
So would you say, you know, whenever you guys dispose of gloves, as far as you guys know, you're dumping in the bin that's not the proper label for it. Do you guys know where the majority of your waste comes, or where it goes afterwards? Do you feel like the hospital handles it responsibly?
Does Jackie have like a fundraiser?
I know that biohazard has to be treated differently from regular hospital waste, and gloves that are not contaminated with body fluids are technically not biohazard. So you guys can look into this more. Anyway, so biohazard you have to pay more to dispose of. It has to be processed properly. It has to be burned. And as opposed to regular like municipal waste, which is disposed of to the dump wherever they.
So it's almost arbitrary to the person who, I guess, is disposing of it. He says it's pretty much, you know, I got a little bit of fluid, or if there's no fluid on this, it's pretty much up to them for the most part.
Right, it is part of our training. Of course, sharps go in the sharp container, and that's automatically biohazard because it's been contaminated. But, you know, things like gloves or sponges or gauze, it is kind of up to your discretion where you put it, but we only have one choice, and that's biohazard.
Okay, well, it was very nice talking to you guys. Thank you for your time.
Thanks.
More than 2 million tons, or about 90% of medical waste, is incinerated every year. There is no form of clean incineration. Incineration can release harmful dioxins and other pollutants that can cause asthma, cancer, and respiratory diseases. Some hospitals and medical centers have on-site incinerators, and some have other companies come pick up their medical waste. People who live near the incinerators are at a high risk for certain cancers.
In a study conducted by the World Health Organization, or WHO, the distribution of hospital waste in developing countries are 80% general or healthcare waste, such as like just regular trash you're throwing out, 15% pathological infectious waste that have come in contact with somebody who's actually sick, and 3% chemical or pharmaceutical waste, which is like your prescription pills and all that stuff that they can't just, you know, keep around, and 1% sharp waste, like needles, scalpels, all that stuff. And these biomedical waste may be generated from hospitals, healthcare centers, clinics, pharmaceutical labs, blood banks, funeral parlors, medical schools, and research institutes. In the past, many hospitals simply dumped all waste streams together, from reception area trash to operating room waste, and burned them in an incinerator. However, incineration has been found to be the leading source of highly toxic dioxin, furans, mercury, lead, and other dangerous air pollutants. These emissions have serious adverse consequences on worker safety, public health, and environment. Dioxins, for example, have been linked to cancer, immune system disorders, diabetes, birth defects, and other health effects. Medical waste incinerators are a leading source of dioxins and mercury in the environment. It costs roughly 67 cents per pound to burn medical waste in an incinerator.
So basically, in conclusion, medical waste is causing a major problem to the communities living around these incinerators. It's causing them to get sick through the emissions or the pollutants coming through the streams or through the air. And the major thing that we need to do is to put as much attention as possible onto the hospitals to try to get them to change the ways they're disposing of their medical waste. There are alternatives to pressurizing them, you can steam them, or even find ways to minimize the amount of medical waste.